Freedom Caucus says no deal, according to the AP 22 minutes ago. Kate Snow, there are not enough votes as of 1:30 today, says Representative Mark Meadows. The Freedom Caucus, has a problem. I mean, this bill has two different problems, one from the left and one from the right. And I'm talking about where people position themselves. I'm not talking necessarily the ideological claims because, they're all right. But the big issue right now is, first off, is with essential benefits. We've talked about this. Prior to the Affordable Care Act, which the best parts of which were the Patient Bill of Rights, insurance was a crappy product. It was like a car. The analogy I was using was without an engine. But you don't realize it doesn't have an engine until you get onto the highway. Or it's a severely underpowered engine, let's put it that way. And you don't realize it until you get on the highway. You're driving through the streets and you're like, this car goes 30 miles an hour. And then you get on the highway and this car goes 31 miles an hour and you have a real problem. And that's where you really need the engine to work. Well, the Affordable Care Act basically said, hey, this needs to be a full-size engine. You can't have, and this stuff there's two different types of regulations about the product. One, you can't have rescission. You can't have lifetime caps. You can't have annual caps. You cannot deny people with pre-existing conditions. Those are all in the Article 1 of the bill. And then there was also a provision saying that it must supply essential benefits, like, I have a list of some of them here. 10 categories of procedures that all insurance plans offered to individuals or small businesses must cover. Outpatient care without a hospital admission, known as ambulatory patient services. Emergency services. Hospitalization. Pregnancy, maternity, and newborn care. Mental health and substance use disorder services, including counsel and psychotherapy. Prescription drugs. Rehabilitative and habilitative services and devices, which help people with injuries and disabilities to recover. Laboratory services. Preventative care, wellness services, and chronic disease management, pediatric services, including oral and vision care for children. All of those things must be included if you're going to sell a product known as insurance, health insurance. So you as a consumer do not have the freedom to buy insurance without, let's say, pregnancy or maternity or newborn care, or without prescription drugs or mental health, or you don't have that freedom. Well, the reality is, no. The insurance companies don't have the freedom to not offer it. We have plenty of, you also don't have the freedom of buying soda with added lead.
That's the same. It's
the exact same
logic, right? Exactly.
You don't have the freedom to buy meat that has been, kept stored in a vat, the same train where they're delivering manure. And
they're working on all of these things, by the way.
And the thing is that I can tell you that meat would be significantly less expensive if we could just import, all the candy we wanted from China without having any regulations. That candy would be much cheaper. And so here's the interesting thing. There are two different problems. One problem is that these things, and including Article 1, these restrictions on what go into health insurance, no one is quite sure how the parliamentarian in the Senate will rule as to whether or not you can legitimately remove those things in a reconciliation bill. Because in the Senate, there's something called the Byrd Rule, which named after Senator Byrd, which says it has to directly affect the government budget. That's the first part of the Byrd rule. So no one's quite sure of that. And they're afraid they're going to get the bill to the Senate, and the Senate's not going to be able to do it via reconciliation. They certainly won't get 60 votes, and it'll be dead on arrival, and everybody will look like an idiot. There's also some talk, well, they could nuke the Byrd rule, perhaps. But that's a lot more complicated. The second aspect where they would run afoul of the Byrd rule is, and this gets a little complicated, but like I say, if I can sell a car that only goes 30 miles an hour and get it street legal, it's going to be a cheaper car. Okay? So they are afraid that if they strip all these things out as from health insurance, because make no mistake about it, an insurance company is not going to offer these. One insurance company is not going to say, like, I'm going to have a competitive advantage and I'm going to offer pregnancy, maternity, and newborn care. And I know there's libertarians out there itching to call in and say, but if they do that, they'll attract more business. Yes, from people who are going to use their services, and they don't want people to use their services. That's not the way insurance works. You don't want to attract the people who are going to need this stuff because they're going to need this stuff. You want to attract the people who aren't going to need this stuff. And it's just, you don't know who it is. But if you're the only one offering it, you get a better sense like, oh, darn, I'm getting all the people who are going to need these services. And so what's going to happen is insurance, the cost of insurance will actually drop. And the Republicans are afraid because they are offering subsidies in the forms of refundable tax credits that are not big enough to allow poor people, essentially, people living in poverty, to buy health insurance. But if they strip health insurance of all the things that actually make it expensive, like covering illnesses, then people living in poverty are going to be able to afford to get health insurance with these refundable tax credits, and more of them are going to use it. And that's going to actually make this bill contribute to the deficit. It's going to make the bill cost more. And you cannot pass something through reconciliation with the Byrd rule, anything that's going to increase the deficit.
It gets a little wonky.
But the funny thing is that they are afraid of both providing a good product to people, and if they provide a crappy product, they're afraid that people living in poverty will be able to afford it, and they're going to have to offer those subsidies. So the easiest thing to do in this situation, if you're a Republican lawmaker, maybe just like, I'm going to vote against it. Hey, everybody, Sam Seder here.
Donald Trump is a bad guy. Believe me. It's true.
It is true, and you can subscribe to this channel by subscribing to this channel. It's true.